Okay, thanks so much, everyone. Appreciate you all joining us in person and those of you who are online for our discussion with Scott Higham and Sari Horwitz to talk about American Cartel. Their book that was just released a couple months ago about the inside battle to bring down the opioid industry. My name is Regina LaBelle. I am with the O'Neill Institute. I'm also the director and a professor in the Addiction and Public Policy program at Georgetown University's School of Arts and Sciences. I have worked on the addiction issues since serving in the Obama administration in 2009, and served last year in the Biden administration as the acting director of the Office of National Drug Control Policy. And during that time, I really got to become familiar with the important work of the Post on the issues relating to the opioid industry and what began at the time in 2009, 2010, 2011 as really an epidemic that was driven by prescribed opioids. And as we know, it's now morphed into an epidemic that's been driven by illicitly manufactured fentanyl. But what's really important is that I think as investigative journalists, Sari and Scott have really dug into the issues. And I want to first thank them for coming here today and speaking to us. And I'd like to ask first if you would tell us a little bit about yourselves, since we're at an academic institution. I think it's really good to share kind of your career paths, why you chose not to go to law school. But tell us a little bit, and we'll start with you, Sari.
Hi, everybody. I'm glad to be here at Georgetown University Law School. So my name is Sari Horwitz. I've been a reporter at the Washington Post for nearly 40 years, and I came as a summer intern. I went to Bryn Mawr University, Bryn Mawr College, and then I went to Oxford University, and I was also always interested in being a journalist, especially an investigative journalist, growing up in Arizona at the time of Watergate. And Woodward and Bernstein and their work really influenced me, and I think influenced Scott too. We're sort of the same age. And that's the kind of work I really wanted to go into. In college, I was involved in my college newspaper. After college, went to work at Congressional Quarterly. Anyway, I came to the Post as a summer intern, and then kind of worked my way through all of the beats that reporters work on. I was a night police reporter in DC in the late 1980s during the time of crack cocaine. So that was a wild time to be to be working police at night. And then just worked my way up, covering courts, covering City Hall, covering national beats, and then criminal justice, and eventually made it to the investigative team at the Washington Post, and began working with Scott. We've done several big investigations since probably 2000. And I did one on the police in the late 1990s. And we've written, this is our second book together. And we really like, rather than we both have covered beats, daily beats, where we're writing the news every day or every week. And we both very much like taking a topic like this one and digging deep. And Scott can tell you more about how we started on doing that in this book.
Thanks.
Hi, everybody. My path was slightly different. My father was a homicide detective in the South Bronx, New York, on Long Island, and I always thought that I'd be a cop. And to make a very long story short, I was going to be an FBI agent. I applied to law schools because at the time they wanted law degrees or accounting degrees. And I got into a bunch of law schools in New York, and by then I had fallen in love with journalism at Stony Brook, where I grad, and was the editor of my college newspaper. And so I couldn't get a job as a journalist, so I applied to all of these law schools. I took my LSATs, horrible. And in fact, the first time I took my LSATs, I didn't prepare for them, and I totally bombed it. And then I took one of those captain classes, and I did really well on it. So I had to explain in my applications why I had those discordant grades. But anyway, I was going to go into the FBI, and then fell in love with journalism, and instead of going to law school, culminated grad Graduate School of Journalism accepted me for some reason and offered to pay almost my entire tuition. So I decided to go to Columbia and pursue a career in journalism. I started out at the Allentown Morning Call, been great years from Pennsylvania. It used to be called the Lehigh Valley Grace newspaper. Then I went to the Miami Herald, which was like journalism boot camp. I loved working in South Florida. It was just crazy. If you're a cop or a prosecutor or a journalist, it is the most awful place. And then I worked for the Baltimore Sun when it was a great newspaper. And then I came to the Washington Post 22 years ago. And the first thing I did was work on a project with Sari about the mistreatment and deaths of foster care children in Washington, D.C., who were working together on and off ever since. I've been working on this opioid investigation for 6 years now. And Sari and I have been working together for 4 years on this project. And I feel like it's just a never-ending story, sadly. It began with prescription drugs, and then it morphed into heroin briefly, and now it's all chemicals all the time, fentanyl. And it's really a horrible thing. But we can talk about how we got started on our book.
Great, thanks. So because they're too modest to admit this, I want to say that, in speaking to them, that we need to recognize their excellence as reporters. Sari has been awarded the Pulitzer Prize 4 times, and as has Scott. He was shared the Pulitzer for investigative reporting for a series about the deaths of children in the foster care system that he mentioned with Sari, and the fatal police shootings and civil consequences to families and municipalities, all of which resulted in change as a result of their reporting. And I think this isn't just about nice stories. It's really about how to affect change. How can policymakers use this information that they provide, the investigative journalism that's so important in our democratic society that they provide to make change. So, and the other book is Finding Chandra, which is about Chandra Levy, who was an intern in, I'm not sure if she was an intern, but an employee on Capitol Hill who was murdered, and it's another DC story. So that said, they've established their bona fides about these issues, and I'm just so happy to have you here to talk about this. I really enjoyed the book, which, and we were talking briefly about this, because the book is divided up in kind of the detective story part, which is the first part, about the Drug Enforcement Administration and their efforts to address the issues of the opioid industry at the time. And then the second part is about the litigation that we're still in the middle of. We're kind of towards the end. Hopefully we're towards the end. But it's divided up into the detective story and a legal thriller, if there is such a thing. A legal thriller, the second part. So I want to talk about the first part first. So I'm going to ask you a couple of questions about that. So the DEA, the Drug Enforcement Administration, as you know in its name, they're an enforcement agency. The division that this book focuses on is the Controlled Substances Division, the Diversion Control Division, which is law enforcement, but it also has kind of a regulatory aspect. It licenses prescribers, it licenses pharmacies, etc. But there obviously was a friction that was apparent between leadership towards the end of the first part of the book. Leadership that was really talking about encouraging compliance rather than using more traditional enforcement mechanisms. And Joe Renazizi, who's mentioned in the book, who we all know is an attorney, an FBI, a DEA agent, and a pharmacist. And he was operating in this structure. So tell us, if you could talk a little bit about that friction. And Scott, maybe you could start by talking about that friction between the role of the Drug Enforcement Administration and that diversion control, and kind of how Joe was kind of caught in the middle of that.
Yeah, so, excuse me, Joe Renazizi is another guy from And so I hit it off with him immediately when I first met him. He had a story about how he was pushed out of the DEA because he went after these drug companies, and a lot of people didn't really believe him. But after we did some investigation into his claims, we began to realize that what he was saying was true. And what he was saying was that he tried to get these companies to comply with the law. And there's manufacturers, and then there are drug distributors, and then there are the pharmacy chains. So that's basically the supply chain of pharmaceuticals in the country. And at every stage of the supply chain, these narcotics were leaking out to the black market. And so rather than go after doctors who were writing prescriptions because they felt like they could just do that all day long, and every time they arrested a doctor, another one would pop up. They're just bad doctors everywhere. They wanted to move up the food chain, just like any good law enforcement officer does. And so they moved up to the drug distributor level. And they also moved up to the drug manufacturing level. And they started finding them, and they started shutting down their companies. And these companies, as you can imagine, are very, very powerful. They have a legion of lawyers, lobbyists, and members of Congress on Capitol Hill who are beholden to them, who get a lot of money from them from campaign contributions. And these companies started to apply a lot of pressure on the DEA and the Department of Justice to get Joe to stop what he was doing. The companies would say, we're trying to comply, we're having trouble, and Joe had heard enough of these excuses, and he felt that the only way they were going to comply is A, being fined, B, having their DEA registrations yanked, or C, sending some of these people to jail. And sadly for Joe, he lost that fight. He was demolished by the DOJ and DEA powers on Capitol Hill. And so the whole first part of our book is a deep dive into this world, into Joe's world, and all the people who were around him. And they were all basically taken out and removed from their positions by the leadership at DEA and DOJ. And a new group of people came in with a message that they were going to be more friendly to the industry. They're going to help industry comply with the regulations of the Controlled Substances Act, etc. And they didn't really comply. So you see where we are now. This could have been completely prevented if these companies had obeyed the law.
Great, thanks. So picking up on that, one of the groups you write about a lot is the Healthcare Distribution Alliance, which is a perfect DC name for a very powerful institution. It's kind of not something you hear about every day. So can you tell us a little bit more about them and what influence do they have on this whole process and the compliance piece?
Sure. Before I answer that question, I just want to add something to what Scott said, because he talked about these companies. And one thing that's important about this book is that when most people think about the opioid epidemic, they think about the Sacklers. They think about Purdue Pharma. They think about Dopesick. I don't know if any of you have seen the show Dopesick. And what we found, and I'm going to get to the health distribution ones, but this is important. What we found is that there's this other group of companies that moved into the market after the government started going after Purdue. And actually, there were some executives who were charged with misdemeanors. After that happened, these other companies moved into this huge, very lucrative market. And some of the companies you may have heard of, they're household names really, Johnson & Johnson, CVS, Walmart, Walgreens, and others you haven't probably heard of. There was one company called Mallinckrodt we really didn't know anything about, based in St. Louis. And they actually made 30 times more pain pills than Purdue. For every one Purdue pain pill, they made 30. Or McKesson, or AmerisourceBergen, Cardinal Health. And these companies together are what the DEA referred to us. They said, they operate like an American cartel. And along with these companies was the trade association, which was there are a lot of trade associations in Washington. And this one mostly represented the drug distributors. the big three are McKesson, Cardinal Health, and AmerisourceBergen. And as Scott said, you have the manufacturers, it's very important to understand the supply chain. Manufacturers, the middlemen, the distributors, and the pharmacies, and of course the doctors, but that's the supply chain. And what Joe Benazizi focused on, and you said you know Joe well, has he spoken to you before? Or?
He hasn't.
Okay, well, Joe Benazizi really focused on the distributors because he was knocking down the pill mills in Florida. He was going after companies on the internet, but he realized this is so much bigger. And the distributors, under the Controlled Substances Act, they have an obligation when they see a suspicious purchase coming in from a pharmacy, a very large purchase, maybe they purchased 100 pain pills one month and then 2,000 the next month, so something suspicious. Under the Controlled Substances Act, the distributors are supposed to stop that shipment, do due diligence, find out why is the pharmacy ordering more, huge amounts, and tell the DEA. And the distributors were not doing that. So, and again, the Healthcare Distribution Alliance is the trade association for the distributors. So when Joe started going after these companies and shutting down their warehouses with the tools of the DEA and causing them to have to pay incredible fines, except for them, they were just speeding tickets, but millions and millions of dollars of fines. The companies got pretty upset and they started to fight back. And one of the things they decided to do, and this group helped them do it, which is lobby Congress to change the law and make it harder in the midst of the opioid epidemic for the DEA to go after them. So there's a law, remember the name of the law?
Ensuring patient access and effective law enforcement.
Right, it sounds really good, right? This law really all it did ensure any kind of patient safety or law enforcement. It took away really the power of the DEA to quickly shut down these warehouses. And HDA, this group, which is the trade association, helped lobby members of Congress, basically helped find sponsors of this bill, champions of the drug industry, to push this bill through. And incredibly, every member of Congress basically signed on to it. Afterwards, when we were writing about it, they came forward, Joe Manchin said, I didn't have any idea what this bill did. But this bill pretty much sailed through Congress, unanimous consent. No one voted against it, and it went through the Justice Department. And this is all after Joe had been taken out and his team taken out, so there was no one to really protest it anymore. And so this group was very instrumental in the lobbying of Congress to pass a bill that undercut the DEA.
Nice. So I actually wanted to also ask about, the title of your book, and you touched on this. When we think about cartels, we think about, bad guys in other countries. We don't think about American companies. So, obviously this is a decision that's made to sell books, but I don't think that it really was just that. There's more to this about the choice of those terms. Some of the people in the book also talk about that. Maybe you could expand a little bit about that.
Yeah, this book is based on, probably interviews with about 40 DEA agents, supervisors, and investigators, along with thousands of documents and interviews with all the lawyers, and we got unsealed, millions and millions of records and data points. But the DEA agents who worked in Colombia, who worked in Mexico, would tell us that there was very little difference that they saw in the behavior of these companies north of the border than the organizations they were seeing south of the border. They had the same command and control structure. They had, the manufacturers of these, super labs, at the very top, these distribution networks, and then on the street level, they would have, they would have these street corner dealers. And it was the same exact kind of formula for making lots of money. And if people died along the way, it was just collateral damage. I don't think the cartels want people to die. I don't think these companies wanted people to die, but that's just what happens when you're dealing with narcotics. And so they just saw these companies as drug dealers in business suits, basically, in lab coats with ties and hiding behind these venerable corporations and their law firms. Most of them are based in this town, and they're some of the most powerful law firms on the planet. And so they kept them out of trouble, these law firms. They also made sure that there was legislation that was going through that was going to impact these companies, that they shut it down, and vice versa. They made sure that legislation that would benefit these companies would go through Congress. And so they had the other metaphor is that they behaved like the five families of the mafia in New York, where they had their consigliaries and they had this structure where they communicated and they cooperated for the common benefit of them all making money while at the same time competing against each other. And that was happening here. It was happening through that one trade organization. There was another one for the chain pharmacies. The emails that we got unsealed, the documents that we got unsealed showed that there were lots of communication between drug distributors, manufacturers, pharmacies, etc., about what they could do to stop the DEA from interfering with their business.
Yeah.
That's pretty good.
Okay, great. So, obviously the activity that's outlined here is illegal. What we have heard, and I'm sure you likely have heard this too, is that, people had grown dependent on these drugs and had a substance use disorder. So there's a part of the book where you cite a pharmacist who says that prescription opioids were limited every day to ensure that the real pain patients could get their opioids. Now, was there there are real pain patients, people who need opioids who now are in tough spots because of the restrictions that have been placed. Do you recall any discussion at the time about pain patients and limits on their ability to get opioids as a result of some of the cutbacks or the takedowns that occurred?
So, that's a very interesting anecdote that you picked up on, and if those of you who haven't read the book, do you want me to tell you the story?
Sure, yeah.
So there was always a question, well, did these companies really know what was going on? Did the pharmacies really know what was going on? And in this particular instance, she's talking about a pharmacy, a CVS in Florida, where there were lines around the block to get pain pills. And the DEA was kind of watching this and looking at what's going on. We have a particular agent, Ruth Carter, who's gone down to Florida to see what's going on because they're hearing about this problem. And so Ruth Carter goes into the pharmacy and says, look at your parking lot is full of people shooting up and crushing pills and people who are getting high, and there's a line around the block. What's going on here? And the pharmacist says, oh, well, we cut off the line at 2 p.m. and saved our supply for the real pain patients. And so the point being, they knew what was going on. We have another anecdote in the book. This involves Walgreens, again in Florida, where there's a police chief who's really concerned because people are coming into the Walgreens stores and they have prescriptions from different doctors, and the parking lot again is kind of an open air drug market where people are crushing the pills, they're snorting the pills, they're getting in the car high. There's a lot of crime, and I think this is Oviedo, Florida, is my memory. Mm-hmm. And so the police chief writes to the 3 top executives at Walgreens and says, can you please do something about these 2 Walgreens here? We have a serious problem. And explains what I just explained. No response. No one ever wrote him back. And then later, of course, the Walgreens, when they're having problems with thefts and crime, they came to the police department and said, can you help give us more protection here? And he was like, the police chief was like, seriously? I've been asking you to do something about it, and now you're asking me to protect you. Point being here is that these pharmacies absolutely knew what was going on. There is a question about, so on the point of legitimate pain medication, so these are legal drugs, right? These are drugs, these pain pills are very important for people who are in severe pain, who have surgery in the hospitals, who are in hospice, who have cancer. That's the the use of these pains. And so there's been the question raised about, whether, cutting the supply, doing something about the supplies could hurt those patients. And Joe Renazizi, in fact, was very concerned about, the DEA, there's something that's very complicated, and I'm not going to get too much into it, but it's called a quota, where they allow a certain amount of these pain pills to be manufactured every year. And some people, this is sort of a talking point for the drug industry, say, well, why didn't the DEA lower the quota and stop so many pills from being manufactured in this country? And what Joe Renazizi says about that is that's very tricky, because we're basing the quota on the amount of prescriptions being written by doctors. And if we just randomly cut it, you could be hurting the production for legitimate pain patients. So that was a concern, and it made it very difficult during the height of the opioid epidemic.
Right, good point. And talking about this brings me back to the time I was in the administration dealing with all this, watching what was going on in Florida and feeling, a little bit, watching it morph into, it really was a criminal conspiracy after a while. And I think you've captured it well in the first part of the book. So now I want to switch to the second part of the book. There's a lot of discussion about the multi-district litigation overseen by Judge Pulitzer in Ohio. And one piece of litigation that has been discussed quite a bit in the Post and in other newspapers is the automation of reports in consolidated order systems, or ARCOS database, which is a database that of all the drugs that are distributed, the controlled substances that are distributed around the country. Vast database, very proprietary. Even in the administration, we were not able to get hold of it. So a sole practitioner brought the lawsuit to get the ARCOS database. And I wanted you to talk a little bit about this. Scott, maybe you could talk about this, why this was important. And then also just, for folks here who are being trained to be attorneys, the sole practitioner is a real hero in the story, I think. So talk to us a little bit more about this piece in the book.
Absolutely. So it's kind of like a Law and Order, So the first part of the book is the detective story, and the second part is the legal thriller. And the second part of the book begins with a character, a guy named Paul Farrell, and we try to tell this book through characters and people who are on the front lines of this battle. And so Paul Farrell is a small town lawyer in Huntington, West Virginia, and they're having breakfast one morning, and Huntington, West Virginia had been hit particularly hard by the epidemic. A lot of people were dying there, and there was a discussion at the breakfast table that morning because the local reporter for the Charleston Gazette-Mail had gotten access to a small piece of this database. They sued for access to it for the West Virginia portion of it. The DEA tracks the sale and distribution of every single narcotic in America. And that's what this database does, traces the path of every pill. And so Paul's brother said, Paul, why can't you do something about this? I mean, you're a lawyer, and this is what you do for a living. And so that set Paul onto this journey, right? And he started trying to figure out, how do I use the law to fight these companies and stop the carnage in my community? And so he focused very quickly on the public nuisance statutes in West Virginia and said, why can't I use these statutes that were designed to shut down crack houses or houses of prostitution or somebody's home that's been turned into a garbage dump? There's no bigger public nuisance in his mind than a bunch of out-of-town drug companies flooding his community with narcotics. And so he started filing these lawsuits, but he knew that he needed to get access to a full ARCOS data set. And it's just hundreds of millions of lines of code. And so they launched the multi-district litigation. Everybody should know what that is, right? There'll be a quiz after class. This is the largest class action in U.S. history that's happening right now. There's almost 4,000 communities that are suing about 2,000 companies. And so as part of this litigation, the federal judge in Cleveland who's overseeing this mass tort, Judge Pulitzer, he granted access to both sides so they could look at the database. And he also started granting access so they could look at all this discovery And the discovery was starting to be admitted into evidence. And so the Washington Post, we said, look, this is a public proceeding. Now you've introduced this in court, and we should get access to it, and the judge denied it. He said, you're not getting access to it because this is part of ongoing negotiations to settle this case. And we tried to get a law firm out. So we have our own internal, legal department, but we wanted to get help from outside, from a big law firm, Williams and Connolly. We usually turn to, but there's a number of huge law firms in town here that we figured could help us. Every single one of those law firms, for the most part, declined because they were already representing one of the defendants in the case, and they refused to grant a waiver. They all said nope. The companies would not waive. And so all these companies bailed out. And so we started, our local legal department started calling Ohio lawyers. And we needed somebody who was in the bar there, so the case was pending in Cleveland. And they said, well, Karen Lefton's a great lawyer, and she, used to work for the Akron Beacon Journal as their in-house counsel. Now she's out on her own, and she represents, does lots of FOIA work and lots of public access work. So we hired her, and this is the biggest case of her career. And she went up against, the law firms for Cardinal Health, for McKesson, some of the biggest corporations in America. McKesson is either the fourth or fifth largest corporation in America, backed by these massive law firms. And she won. First, we got turned down by the judge, and she won in the Sixth Circuit Court of Appeals in Ohio. And they had to turn over this entire database, which the Washington Post then did our analysis and published it, and found that these companies manufactured, distributed, and dispensed over 100 billion pain pills over the course of what was a 6 years. And by company, by manufacturer, by distributor, by pharmacy, you can go online now onto our website, and you can see in your own community where you guys grew up which companies are responsible for flooding your community with how many pills, who manufactured them, who distributed them, and who dispensed them. And that was a huge, huge victory for these attorneys, because then they could say with precision which companies were responsible for the devastation of these communities.
Great. So it's an important part of the case, and I would say it's, in reading that, as she said, it's every attorney's dream. I would say it's every law student's dream too, to have that kind of David and Goliath case where you're going up against those interests. It was important to the case, but it was also important, you shared that database with other newspapers. And so why is that so important? Why was that so important as part of your efforts?
Well, Scott and I did, and a group of reporters at the Post, because there were so much data here. We did a number of stories right after we got the data. And let me just say, the Post bought on an emergency basis a brand new computer server to crunch the data because there was so much. And also along with the data, we sued for the documents involved in the lawsuit, all the internal documents, all the internal memos. And I'll tell you more about that in a second. But we were able to do a number of stories right away, but we wanted communities all over America to have access to this, and for local reporters to see, for example, in my hometown of Tucson, Arizona, for the local reporters there to see the information and write stories about their particular community and how it affected their community and what companies were involved in. I think it was possibly Walgreens or what manufacturer. And so we wanted everybody around the country to use this data beyond what we were able to do. And so we also got all these documents from each company, all these internal documents. And this was important. In fact, we put an entire team at the Washington Post on this because we wanted to get that out very quickly, what was in the documents, and two people couldn't do that by themselves. We needed the whole team. And that was an incredible juxtaposition and really disturbing for us, because Scott and I, by that point, had been going out to communities all over that had been hard hit by the opioid epidemic. We used CDC data to see, where the most deaths were, where the most addiction was, and we'd gone to Southern Ohio, we'd gone to New Hampshire, we were traveling all over, we were hearing stories in these communities. When you go in and you ask people, do you know anyone who has died from an opioid addiction, who is struggling with addiction now? Everybody knows somebody, is related to someone, has a friend. I mean, it's different than the bubble we're in here. I mean, really, everybody's been so touched by it. There's so much grief, there's so much struggle. And these documents, we would see from one company, and we can share, we can do a little reading here for some of this. The memos and the emails would show the callousness of these companies and how in internal emails they were laughing about the addiction. They were making jokes about it. And, that juxtaposed what we saw on the ground was so upsetting. Do you want to maybe?
Yeah,
okay.
Totally.
So we'll each take one of these. You can tell the Doritos story, right?
This company, Mallinckrodt, who we mentioned before, the largest manufacturer of oxycodone in America. Their pain pill, it was M on one side and 30 on the other. It was baby blue in color. That was 30 milligram pill. So has anybody ever gone to the dentist and had hydrocodone or oxycodone prescribed to them? It's okay. So those are usually 5 milligram pills. These are 30 milligram pills. And so one pill, this is like the equivalent to a hit of heroin. And Mallinckrodt was turning these things out by the hundreds of millions. And they were making a lot of money. And their national sales director was a guy named Victor Borelli. He's another guy from Long Island. There's a weird Long Island nexus here. He's a bad guy from Long Island. So Victor Borelli was he had a nickname within the company. It was like sell, sell, sell. That was his motto. He was a very aggressive salesman. He'd come from, what was it, Sara Lee, where he was selling pound cake before he started selling oxycodone. We're not making this up. And then he started dealing. He had all these distributors he was working with that were distributing his drugs. And one of them was called KeySource. They were a company that was in Ohio, like a mid-sized drug distributor. And so Victor Borelli got an email from this guy, and his name's Steve Cochran, and he said, so Steve Cochran says, I need more of these pills. He says, keep them coming. They're flying out of here. It's like people are addicted to these things or something. Oh wait, people are. And Victor Borelli writes back, just like Doritos, keep eating, we'll make more. And so there were so many of these kinds of emails where the people who were in these companies knew exactly what was happening. They knew people were dying from their product. And they just they dehumanized these people, and maybe so they could sleep at night. I don't know why, but there were multiple examples. And there was another one that's equally horrific, you guys are all really young, but when we were kids, there was a show on TV called The Beverly Hillbillies. Has anybody ever heard of this?
1960s CBS sitcom, Beverly Hillbillies. These guys are laughing. Do you know this? Do you remember this?
Well, yeah, sure.
So it was about a bunch of hillbillies from Arkansas or wherever, and they hit oil on their property, and they suddenly become gazillionaires. And so they load up the truck and they move to Beverly, and they move to Beverly Hills. And so it's like a classic fish out of water story where they're hanging out in Beverly, but they're all still hillbillies with their jalopy and their accents and everything else. It's a horrible trope about hillbillies.
And it makes fun of Appalachia, and it's not. But so 2011, again, we're now really the height of the opioid epidemic, and in the company AmerisourceBergen. So this is a distributor, and they're at this point trying to lobby against a law in Florida that was trying to tighten up. It was guidelines for doctors, I believe. Was it a new bill that was going to make it harder to doctor shop when people who were struggling with addiction were going from doctor to doctor. And they're lobbying against this bill. And so a couple of the lobbyists and also the couple vice presidents, corporate vice presidents, pass around a parody in an email. And this is something we were able to get from the litigation. And it was to the theme song from Beverly Hillbillies, but it said, "Come and listen to a story about a man named Jed. A poor mountaineer barely kept his habit fed. Then one day he was looking at some tube and saw that Florida had a lax attitude about pills, that is, hillbilly heroin, OC, oxycodone. Well, the first thing you know, old Jed's a driving south. Kinfolk said, 'Jed, don't put too many in your mouth.' Said, 'Sunny Florida is the place you ought to be.' So they loaded up the truck and drove speedily. South, that is. Pain clinics, cash and carry." They're laughing because they know the music, a bevy of hillbillies. So these executives at AmerisourceBergen sent around this email, kind of making fun of it while this is going on. And this came out in the litigation during a trial in West Virginia. We both went to this trial in Charleston last summer, but was it last summer? It's all running together. And this came out, and somebody put it on Twitter who was watching the trial, and there were death threats against the AmerisourceBergen executive. And it became such a big thing that the judge called in all the lawyers and said, "Okay, no more emails." And the lawyers for the plaintiffs said, "Wait, we have so many more. We have so many more we want to put in the trial." And he said, No, I get it. No more emails." So it's very, very sort of fiery exchange.
And we have this great scheme. A lot of the book is these scenes, it's to try to bring this to life. This is not a policy book. And so there's a guy named Rex Chapman who, if anybody is an NBA fan or a college basketball fan, he's really big. He has gazillions of followers, and he used to be addicted to opioids. And so when he saw this being reported in the local press about the Beverly Hillbillies email, he tweeted it out and said, "These people are monsters." And then he tweeted out a photograph of the AmerisourceBergen vice president who was testifying. And he tweeted out a picture of his wife, and then it just blew up. And that's when all the death threats started coming in. And that's when the judge literally halted the trial, called everybody into his chambers and said, "How many more of these do you have? This is repetitive. You don't need to keep doing this over and over again." But there, the record is replete with this kind of stuff, and it's really. Sari and I have been reporters. For a combined 60 years, which is a little scary to say. And we've seen a lot of really horrible things in our careers. Sari worked in the police beat. I was in Miami covering cops and courts. We've seen horrible, horrible things. And this, I think we can say without a doubt, is the most horrible thing we've ever seen in our careers.
And I think what's really striking is that despite the litigation that Scott talked to you about, and the successes of the litigation and a $26 billion settlement, no executive of any of these companies has gone to jail, has been prosecuted. There are no criminal cases that have actually gone to the point of prosecution, and no one's gone to jail. And it's for the families of the victims, despite the settlement of money that's going to go help families and communities moving forward over the next 18 years, they're very upset about the fact no one's been held accountable.
Yeah, they feel like there's been no justice, really. These companies are paying money, but they can afford to pay this money. In fact, so there's been a bunch of settlements. Purdue has settled their bankruptcy. Mallinckrodt has settled their bankruptcy. Johnson & Johnson, McKesson, AmerisourceBergen, and Cardinal Health, they all settled together for the $26 billion that Sari mentioned. The day that settlement was announced, the share prices of those four companies rose by an average of 3% on Wall Street. So what does that tell you? This is just the cost of doing business for these companies. And when it's all said and done, it's going to probably be between $30 to $40 billion that these companies will pay. And that money is going to go to the communities for drug rehab, for a lot of the programs that Regina was talking about. It's not going to go into the pockets of paying the families. And the families are left wondering, what about my son? What about my daughter? What about my parents? This entire generation has been lost to this. And like Sari said, not one executive of a Fortune 500 company involved in this opioid trade has been charged with a crime. And a lot of the families feel that that's the true crime that's happening here.
So that was my next question was whether or not you thought people were held accountable, but I think you've answered that. So I'm gonna open it up to the audience. We have about 10 minutes for any questions that folks may have. I'm sure Adrienne has a question.
More a comment, because I'm Adrienne Fu-Berman. I'm Director of Pharm Data at Georgetown University Medical Center. We've done a lot of work on opioids, are currently working on international opioids, but we generally focus on how the pharmaceutical industry manipulates the prescribing habits of physicians and other prescribers. So, but I just wanted to point out that the term legitimate pain patient is really an industry term, and that they're still promoting opioids through continuing medical education, through articles, not just in the United States, but elsewhere as well. But they're doing plenty to protect the market now, but it's all about the legitimate pain patients. And of course, opioids are ineffective for any kind of chronic pain, although they're absolutely effective for the conditions you mentioned.
Adrienne, I may be mistaken about this, but I believe you were interviewed by the Washington Post and are in a video in one of our stories. So this, we did a whole story on the marketing of opioids, and you did a great interview. In case you haven't seen it, it's online, everybody.
Yeah, if anybody wants to read the coverage, you can put in opioid files and Washington Post, and all the stories are there, all the data is there, all these documents are there. There's also a repository that's been put together by Johns Hopkins and the University of California, San Francisco. That is an amazing resource for anybody who wants to do like deep dive research into this material. Purdue's bankruptcy documents are there. Mallinckrodt's documents are there. A lot of these MDL documents are there. And I just wanted to make one other point about Mallinckrodt and why we're at where we're at today. This epidemic that we're facing now, a lot of people believe was created by the U.S. pharmaceutical industry because so many people became addicted to opioids. And fentanyl is just another opioid, it's just much more powerful. But they're all the same drug. I mean, heroin, morphine, oxycodone, it's all the same molecules. And so Mallinckrodt's M30, their most popular pain pill, it's on the street. What the Mexican cartels are doing now is they are manufacturing pills that look exactly like the M30, and it's just filled with fentanyl. And so the cartels saw an opening, they saw a market that was created, and they are now flooding the United States with these counterfeit Mallinckrodt 30 milligram pills that you cannot tell the difference. And so, that this did not have to happen if Purdue Pharma, a lot of people believe kicked this thing off. But when they were shut down by the United States government, they were fined $680 million. They had to reformulate their pills. All these other companies, by diving into this market, if they had all obeyed the law, we would not be where we are today. But instead, these companies, there's guardrails that are set up to prevent this from happening. There are laws and regulations, and they just tore those things down. And now we're facing the worst epidemic in U.S. history. There's no end in sight. 108,000 people in 2021. Who knows what that number is going to be like in this year? It's frightening.
Any other questions? And wait for Bethany has the mic.
Hi, thank you for talking to us today. I'm wondering, you mentioned your experience in journalism and the beats that you were working on, and I'm wondering if you can tell us just was it difficult to approach this from like a book that has a start and an end and is not an ongoing beat when the story itself is still ongoing and then settlements are still happening? What kind of mindset shift did you have to make, and when did you say like, okay, this is the end of the book, even if you wanted to maybe keep writing or keep investigating?
That's such a good question. We decided on the characters pretty early on. Joe Renazizi was clearly going to be the character for the first part of the book. The second part, a little trickier because there are 500 lawyers on each side of this case. So there are a lot of lawyers to choose from. And we decided on Paul because he brought some of the early lawsuits, and then he filed for the multi-district litigation that ended up in all the lawsuits being consolidated in Cleveland in the multi-district litigation. And so because he's the character in the second part of the book, we especially want to follow his trial. What happened is there's a settlement negotiation going on in New York. This is during COVID, actually. And he opted out of that. He said, I don't want to be part of the settlement negotiation. I want to go to trial. And I think his thinking was that he would get a lot more money for his community. It was Huntington and Cabell County, West Virginia, epicenter of the epidemic. And so we followed him in his case. And the original plan was for that to be the ending. And our book, or I think our deadline was January or February of this year. He went to trial last summer. It was a 3-month trial in Charleston, West Virginia. And then it took the judge more than a year to come up with, it was a bench trial, it wasn't a jury trial, and to come up with a ruling. The judge actually came up with a ruling on the evening of July 4th this summer, okay? But we needed to be done by February. And that was, so we kept extending the deadline. Our very nice publisher, editor 12, they kept extending it because we kept hearing rumors the judge is going to issue a ruling. So we kept, and at some point they were like, you know what, if we want to get this book out, you're going to have to come up with an ending. So we decided, well, we can't come up, that can't be the ending. And we ended it with an epilogue that talked about the settlement negotiations and the $26 billion settlement with all the other communities, the 4,000 communities that were part of the multi-district litigation. Now, of course, since our book was published, I think maybe, was it a week before our book was published, the verdict came, and Paul did not win his case. The distributors won the case. And so that's not in, I guess not in the paperback. That's an excellent question.
And the other thing is that it is a great question, just to add just a little bit to that, is that so since we're not beat reporters, we're not covering the epidemic, but we do have reporters in the newsroom who are doing that. In fact, we just posted a job opening for a full-time opioid reporter. So if any of you guys want to bail out of law school, we have a job opening.
I'm curious if in your research you came across any similar practices for other pharmaceuticals. I mean, we know that opioids are not the only pharmaceutical with addictive properties, and while it's not been given the label of an epidemic, addiction to benzodiazepines, for example, are very dangerous and very rampant. Did you notice any parallels or any other patterns with other pharmaceuticals that could be just as dangerous?
You know, it's like one drug at a time, right? So, I mean, we didn't really have the bandwidth to go into like a whole other class of drugs. So we just focused on the drug that was killing the most amount of people. But you're absolutely right, Andrew. I mean, there's all kinds of drugs that are misbranded, over-marketed, over-prescribed, hurting people. Some of you probably know that Purdue Pharma got its start with Valium, and that was their first drug. That was their wonder drug, and that was the first drug that was really branded and promoted to the public. And if anybody's ever heard the Rolling Stones song "Mother's Little Helper," that's what that song is about. It was so rampant, the abuse of Valium by people across the country. And that was all Purdue Pharma. It wasn't called Purdue Pharma, but that was the genius of the Sacco family.
The one thing I'd add to that, though, is that this practice, but when we've talked to doctors about this practice of the pharmaceutical companies hiring, basically paying doctors to give speeches about their particular drug at conferences, that's not necessarily new. I mean, and the idea of sending out representatives to give all kinds of swag and give presents and wine and dine and doctors, that has gone on for a long time. That's not really a new thing. What's different here is that the representatives were told to go tell the doctors that this is not addictive, that this is less than 1% addictive, based on not a study. We don't write a lot about this in our book, but others of our colleagues, Patrick Radden Keefe in Empire of Pain, Beth Macy in Dope Sick, and Barry Meyer in Painkiller, have written a lot about this, where there was a study of Jick and Jick study from 1980, not a study in 1980, it was a letter to the New England Journal of Medicine, one paragraph, where a doctor was talking about his 400 some patients in the hospital, seemingly not becoming addicted, and that was used. Representatives went to doctors and said less than 1% of people will become addicted to this. So that's, while the practice of sending aggressive representatives out, sales representatives isn't necessarily new, this was new, this aspect of it.
Well, thank you so much, and I apologize because we have to stop at 3 o'clock. There's an opportunity for books to purchase here, and our authors will sign them. I want to thank you so much for writing about this, for your work in this space, for shining a light on a lot of these activities that occurred for so long, because when it's so critical to have journalists like yourself reporting on these issues, because without that, it's harder for those of us who are working in the policy space to really move and make change. I also want to note finally that your book is dedicated to the victims and their families, which is really what this is about. And if there's any one final word you'd like them to take away from all the work you've done on this issue, if you want to share anything right now.
To the victims. I mean, what's so incredible to know, and Scott and I are so moved by this, is that some of the parents of children who have died have become activists in this space. And I mean, one in particular, his name is Ed Bish. Look him up, follow him, because he's on top of everything if you follow him on Twitter. And they're now organizing rallies on fentanyl and trying to get Congress, trying to get the Justice Department to do something, and trying to get prosecutions. I mean, these families are really active now and speaking out. And I think that it's a really great thing.
Yeah, it's an important moment. A lot of you are too young to remember when the AIDS epidemic was raging in this country, and people who got AIDS were treated like people who were addicted to drugs. They were outcasts. They were shamed and shunned. And there was a movement called ACT UP, where a lot of activists got together and they changed the narrative and they changed the culture around AIDS, and people became more accepting. Policy followed, and we're in a much different place today because of that movement. And it's our hope that these parents are able to accomplish the same thing in this space.
Thank you very much.